Hi, welcome everybody. I am here today with Christine Taylor, who's joining me to talk about Preeclampsia Awareness Month. We are so excited to bring awareness to this really important issue in women's health. My name is Dr. Rakhi Dimino. I am currently the chair of the Preeclampsia Foundation, and Christine has an amazing story to tell. Christine, can you tell me a little bit about your pregnancies?
Yes. Well, thank you, Dr. Dimino. Yes, I mean, it's an honor to speak with you. Thank you so much for taking the time to just talk to me about preeclampsia awareness. And so I had recently had my second child and born in December 2021. And I had a great experience. It was a beautiful pregnancy, and I just really felt extremely healthy throughout the whole process. I was being seen by a midwife at the time, but it was cleared by my doctors to do so. Especially since I had a great first pregnancy experience. And so they said I was a good candidate for doing a possible home birth. And so I was being seen by a midwife with the goal of doing a home birth for my second pregnancy. And so my first pregnancy was beautiful as well. I had a great experience there, no complications in labor or delivery or postpartum. And so with this second pregnancy, I'll admit, I kind of assumed that I'd have a similar experience. And so while I was still under great care, being seen by my doctors, my midwife, I wasn't aware of what could possibly happen in a prenatal experience. And so for me, even though my pregnancy was great, I ended up having some complications when labor took place. And so I was full term, 39 weeks, and some of the symptoms I was experiencing, I thought were related to just normal labor, things like having some nausea, I had a little bit of vomiting, but it wasn't anything that I felt was any different from a previous birth experience. And so
Yeah,
it wasn't
sometimes birth makes you feel just sick to your stomach, right?
Right, exactly. And so I didn't think of anything was awry. And so when it wasn't until I started having seizures that my midwife knew there was
Oh my
something wrong.
goodness. So you
Mhm.
started seizing at home,
Yes, I
thinking
did.
you were in labor.
Right.
And what happened?
Yeah. So as soon as I started having seizures, they immediately called the ambulance to take me to the nearby hospital. And so I went to North Central Baptist Hospital and was able to fortunately have an OB hospitalist on staff where I was able to have them perform an emergency C-section and deliver the baby as soon as possible.
How aware were you of what was happening as you're being rushed to the hospital? That sounds so scary.
Yes, it was. There was only bits and pieces that I remember from that experience. The seizures really kind of blocked some of the memories that occurred, during that experience. But my husband was able to relay things that occurred during that time. And I mean, definitely very traumatic. I mean, I was not aware that I was going to be going through something like that. And there was nothing preeclamptic during my pregnancy experience. I didn't have any signs or symptoms prior to that. I wasn't diagnosed with preeclampsia. I didn't have any protein in my urine. I had great blood pressure. And so that wasn't even on our radar. And so it wasn't until labor where things really started to happen.
That sounds like you were very healthy before. Some of the risk factors for preeclampsia include obesity, and that can be a struggle for many of us women who've had children before and are balancing pre or post other pregnancy weight and another pregnancy. There's also chronic hypertension, so people
Mm.
who've had blood pressure issues prior, women who have diabetes, and then being either really young or really old. And
Right.
I hate to say it that way, but
Mhm.
these are
Yeah.
teen pregnancies, and then our moms who are kind of at the end of the childbearing years that are at higher
Mhm.
risk for preeclampsia. And it sounds like you didn't have any of these risk factors.
Not at all.
And that's the thing about preeclampsia. Although we say these are risk factors, it can really happen to any of us, any of
Yes.
us.
Yes.
Um, um, you also talked on some of this about some of the symptoms you were having.
Mhm.
I remember you said nausea and
Mhm.
vomiting.
Right. Right. Yeah. And so just going back to what you said about the high risk factors, I didn't have any of them. And looking at the Preeclampsia Foundation website, just the FAQs, they were saying, what are some of those high risk, but then also some of the women actually don't have any of them. So, that's why you said it's very important to just be aware and be under the care of a good physician in order to stay on top of that should anything, occur. But yeah, I don't fit any of those high risk factors. No one in my family has ever had preeclampsia before. I'm, in between the range where it's not younger than 20, not older than 35. Never had, I had a great first pregnancy. So yeah, all of those high risks didn't show up on my medical history, right? And so that was another thing that really kind of made this an interesting situation. But now that I'm aware, it definitely helps me just stay on guard. It's not saying that, because they even have information to say just because you've had it before doesn't necessarily mean that you'll have it again, but that knowing the symptoms, knowing the signs, and then just any of those risk factors now, it really helps your physician just kind of help you stay on top of that for any future pregnancies and even postpartum. So, I'm aware that, while it may happen and you may have preeclampsia during your pregnancy, sometimes those symptoms don't come up until you're in labor, maybe even 48 hours after labor. But then some women experience or eclampsia or HELLP syndrome even after the fact, right? I think
That's
up to
true.
6 weeks.
That's
Mhm.
true. So I'm going to go back to the symptoms. You said nausea and
Yes.
vomiting, but just so everybody is aware, some of the other symptoms of preeclampsia are headaches, especially those that do not go away when you take Tylenol
Mm,
during the pregnancy for that particular headache. And that's one of the things that we will often ask you if you have a headache and if you've taken anything, because headaches can
mhm,
be common in pregnancy for many other reasons. It doesn't mean it's preeclampsia, but
mhm.
this is a very particular kind of headache that it just won't go away.
Right.
Um, in addition to that, visual changes. So some people will see sparklers in their vision um, um, as one of the symptoms. Other things might be things that happen to a lot of women during pregnancy. And so it can be confusing. Things like nausea, a little bit of
Mhm,
vomiting, having swollen legs. Um,
mhm,
can all be a part of preeclampsia as well, but many women experience those symptoms who don't have preeclampsia,
mhm,
but it may be our alert system to kind of check things out. And the way that your doctor may do that is they may follow your blood pressure and see if it's increasing. Specifically, blood pressures over 140 for the top number and over 90 for the bottom number are ones that we have to be extremely careful with. Uh,
mhm,
and they may do some lab work and look at protein in your urine as well, although those don't always have to be part of the diagnosis of preeclampsia. So
mhm,
it sounds like you had a seizure and you were rushed to the hospital
mhm.
and had an emergent delivery, a C-section. All of this must have been incredibly traumatizing. It is definitely not what a healthy mom was planning for
Right, right.
going into this. And tell me what happened after the delivery.
Right. So of course, I had to recover from the high blood pressure. I still had some elevated blood pressure postpartum and while I was still in the hospital. And so the doctors definitely were, just making sure that those numbers got back down to normal. And so I was in the hospital and, actually ICU for several days. And then I was able to go and recover normally in the postpartum ward. And so that was, it took probably 5 days and then I was able to be discharged from the hospital. But even postpartum, I stayed on top of my blood pressure, just checking it regularly, knowing, that something could happen or it could actually get worse when I got home. And so I was told that by my doctor. And so knowing that, I just made sure that I stayed on top of, tracking my blood pressure and just kind of keeping an eye on the signs and symptoms. But I actually recovered fully from that, even with follow-up appointments with my OBGYN and my family doctor. Just everything looked good. My blood pressure normalized. I haven't had any signs of any long-term effects from the experience so far. And so that's been a huge blessing. But yes, I postpartum, I was very lucky. I didn't have anything come up afterwards.
I'm so thankful that that was your experience. For some women, what happens is they have elevated blood pressures, have preeclampsia, complicating their delivery, and then in the first 24 hours, their blood pressure actually goes down, and
Mm,
they seem to normalize. And then right about the time they're supposed to go home, their
mm,
blood pressure starts rising. The
wow.
peak in blood pressures for pregnancies is actually 3 to 7 days after delivery. That's for everyone.
Wow.
And so that can be the most dangerous time in your pregnancy, actually, is 3 to 7 days after you have
Mm,
had your baby, you're home, you're, hopefully with your family and taking care of baby at that time. And so for some women, that time period is actually when they get worse than they were during delivery, or
mhm,
really scary, they develop preeclampsia for the first time ever. And so we want to get that message out to everybody to be aware of the signs and symptoms of preeclampsia, especially even after you have your baby.
mhm,
Really, it can be diagnosed out to 6 weeks after delivery, as you said before, but
mhm.
the most dangerous time period we see is in that a week after delivery, a week to 2 weeks after delivery.
Yeah. Can you tell me how preeclampsia affects the mom and baby?
Yeah, when preeclampsia develops really early in the pregnancy, the beginning of your third trimester, it can actually affect the growth of babies. So babies um, may be too small because their placenta isn't working well, and their placenta isn't able to give them the nutrition through the umbilical cord that that baby needs. And so they end up
Mhm,
being very small. And if mom gets sick or baby's not growing well, it can necessitate an early delivery. And with that, you have all of the complications of preterm deliveries
mhm,
and um, preterm babies. And
mhm,
so that part is really how it can affect babies more than anything else. For moms, no matter when you get preeclampsia, um, the beginning of your recovery, the beginning of being able to recover from preeclampsia starts with the delivery. It's getting that placenta out and not being pregnant anymore. Even though there might be an up and down course afterwards, that is the beginning of the healing process for moms. For moms, it can cause seizures like you had. It can affect their liver and their kidneys, like you had with HELLP syndrome. Um, and in worst case scenarios, it can actually cause strokes. And those strokes can paralyze moms and cause paralysis that is lifelong. And that affects your whole ability to take care of your baby and be the mom that you imagine that you would be to your family
mhm,
if you have paralysis. And so those can be extraordinarily scary. And bringing down that blood pressure very quickly
mhm.
is the key to preventing that from happening.
That's good.
And so you'll see our hospitals act very quickly to try and get those blood pressures
Yes,
down. Right?
for sure. Yes. So, can you tell me what is the Preeclampsia Foundation and how are they helping to just arm mothers with information so they can be aware of all of these things?
So the Preeclampsia Foundation, first and foremost, is a patient advocacy organization. It
Mhm,
is actually created by people who have experienced preeclampsia, either firsthand or their family members have experienced preeclampsia. And the goal of the Preeclampsia Foundation is to someday have a world where no one, no one ever suffers from preeclampsia
mhm,
itself. Um, and then its second purpose is to educate um, and arm women with the information that they need to help their doctors and their midwives recognize that preeclampsia is happening and get the treatment that they need. Um, and then the last part of it is to really propel research forward
mhm,
and start discovering cures for preeclampsia in the future, so that
mhm.
no um, no mom, no baby ever has to suffer from this again.
For sure.
So they work with a lot of medical experts to do that, but are definitely first and foremost want to make sure that moms and their families know what preeclampsia is, what to look for, and how to get help for that.
Yes. So tell me, how did you get involved with the Preeclampsia Foundation?
I actually initially got involved because of an experience I had with one of my very first patients. I was a medical student, barely knew where to go in a hospital at the time as a brand new medical student. And I was seeing a woman who had been sent in for elevated blood pressures by her pediatrician, actually.
Mhm.
Her baby's doctor said, "You don't look well. Let me take your blood pressure," and sent her to the hospital. Um, and as I was talking to her, she literally had a stroke in front of me, fell out
Wow.
of her chair, and had a stroke in front of me. And unfortunately, she was paralyzed for the remainder of her life. I'll never forget her. It was many, many, many years ago. Um, I will never forget her. And she is actually one of the major reasons why I became an obstetrician in the first place, because I felt that no mom should go through that. Um,
Mhm.
at the time, I wasn't a mother myself. I didn't even know the risk factors for preeclampsia, but I was thinking something has to be done about it. And so as my career progressed, I felt like this was a very important thing, organization for me to be intimately involved in. Um, and so I've spent a lot of time with that. One of the things that I'm particularly focused on comes from that particular scenario, and that is postpartum preeclampsia. Um,
Mhm.
I want to make sure that everybody knows that preeclampsia can come for the very first time after you deliver. You may have had a beautiful pregnancy, a beautiful delivery, and go home and develop these symptoms after and still be in just as much danger as you
Mhm.
would have been if you had it during delivery. And so it's still very important to pay attention to that after delivery itself in the first 6 weeks. Um, so if nothing else, I want to make sure everybody knows the symptoms that you and
Mhm.
I have talked about today.
Right, right. Well, thank you so much for that information. And I'm, definitely as someone who survived eclampsia and HELLP syndrome, and just now that, just growing my family in the future, just knowing this information has been so critical for me to just not take for granted and not assume, just because of past, medical history and experiences does not preclude me, from possibly having preeclampsia, in the future. And so definitely, I agree. Just, I highly encourage moms to just stay on top of signs and symptoms, be aware of these things. Exactly what you said. It could be something that develops postpartum, and then also just being aware of these things so they can present it, the information, and keep in communication with their doctors. And so they know to be responsive and be able to address it as soon as possible and navigate that with them. So anyhow, well, thank you so much. And I hope that this information helps and other moms and even healthcare providers so they can save lives and make a difference in these pregnancies.
Yeah, and I hope that moms are able to use this information to partner with their physician
Mhm.
or midwife to make
Yeah.
sure that they can be as healthy as they can during their pregnancy and after.
Mhm.
And that women who have had preeclampsia also bring that information to their doctors in the future. So when
Mhm.
you've had preeclampsia, you can be at risk for heart complications
Mhm.
for the rest of your life. And so meeting with a cardiologist and being screened for those as you go through your 40s, your 50s, your 60s,
Mhm.
and making sure that you are participating in a heart healthy diet, that you are exercising and taking care of yourself. All of those things are important in your future. And then one other thing to talk about that maybe we don't address as much is post-traumatic stress syndrome and postpartum depression. So when you've had preeclampsia, many times it was a very traumatic scenario, and that
Mhm.
increases the risk for postpartum depression and post-traumatic stress disorders. And so making sure you keep that open conversation with your OB/GYN physician or your midwife or your family practice physician, so that you can get any support that you need during those times is very important. So it's really the during the pregnancy, the during the delivery, the after, and then the far after. We want to make sure
Right.
that that everybody is supported in the way that they need. Thank you so much, Christine, for talking with us today. And I know that sharing your story will be important for other women who may now have better information to screen themselves.
Yes. Thank you so much.
Take care.
Yes, you too. Thank you so much, Dr. Dimino.